It's time to sit back, relax, and listen to Conversations with Joan. Conversations with Joan will inspire, motivate, and empower you. Live your best life now. Listen, learn, think, and decide. And now, here's your host, Joan Herman.
Welcome to Conversations with Joan. I'm Joan Herman. Thanks for tuning in. Conversations with Joan focuses on topics that are important to your life, from health and wellness to professional development to personal well-being. Thought leaders and experts join me to share their insights, tips, and strategies so you can thrive and live your best life now. Thank you for taking time for yourself, and thank you for letting us be a part of your life. Now, let's start talking. My first guest today is Dr. Judith Orloff, who says that it's possible to live a more open-hearted life without burning out or experiencing compassion fatigue. According to Dr. Orloff, there are ways to nurture empathy while developing coping skills. Dr. Orloff is a New York Times best-selling author and a leading voice in the fields of medicine, psychiatry, and intuitive development. She's on the psychiatry clinical faculty at UCLA. Welcome, Dr. Orloff. Thanks for joining us.
Oh, you're welcome.
So, Judith, today's world can be brutal. There are so many stresses that can cause emotional burnout or make us sick. And when things get to be too much, a natural reaction is to shut down and isolate. But you say that there are ways that we can be compassionate and engaged while practicing self-protection. So let's talk about people who feel too much or take on the problems and energy of others. We're living in a time of sensory overload. What happens to our body when we take on too much negative energy?
And so I wrote my book, The Empath Survival Guide, to address exactly this, because there's so many of us who are sensitive and empathic and loving and caring, but we tend to care too much. And empaths are people who are emotional sponges and tend to absorb the stress from the world or other people into their own bodies. And so as a result, I'm also an empath and also a psychiatrist, so I integrate those two skills to help patients. But we as empaths and sensitive people need to learn grounding skills and setting boundaries and self-care techniques so that we don't burn out. Because an empath has a body that doesn't have the same kind of defenses that other people have, where everything goes straight into us, as if we're a wire that's not insulated. And that can have very positive effects. It allows you to have compassion and love and passion and creativity and intuition and spirituality, and you're wide open to all those beautiful energies. But the stresses also come in and can affect you really strongly. That's why it's important to practice protection technique.
Judith, are people born as an empath? Is this something that we have from birth, or is it something we develop throughout our life?
That's an excellent question. In the book, I go through, are we born empathic? Is there a genetic component? Now, how do we become empathic? And, some babies are born empathic. In my medical school training, I worked in OBGYN and delivered babies as part of my education, and some babies will come out. They look like little Buddhas and so open, so sensitive, you can just feel it. Whereas others come out, without that sensitivity, and I'm not saying one is better than the other, it's just different. They seem more intact. They seem more grounded and less susceptible to noise, sound, smells, movement. They aren't as easily startled. So I think there is really a temperament element. And there's also, I think, a genetic element, because sometimes empathy and intuition, deep empathy, comes through family. As I know, my grandmother, my mother, my cousins, and myself, we're all empaths, and we're all intuitive. So it came down that lineage of the family. And then also being an empath can be related to trauma. If you've been raised in a dysfunctional home or with an alcoholic or abusive parent, that could beat down your defenses so that the normal barriers that you have up or that you would get from nurturing parents aren't there. And so you tend to feel things more strongly. And part of the recovery as an empath is learning to heal the post-traumatic stress that happened early on.
As you're talking, a word kept going through my mind because I remember growing up, somebody who was probably an empath would just be labeled, oh, she's just overly sensitive, and almost written off. Is that the same type of person? Is that what we're talking about?
Oh, yes, exactly. It gets me so mad. It happens all the time. I mean, when I was growing up, my parents said, oh, you're just overly sensitive. Oh, just get thicker skin.
Mm-hmm.
Oh, get stronger. And what that did was made me feel like there was something wrong with me. I had a certain temperament. I was really a sensitive child, and there's a chapter in the Empath Survival Guide on raising sensitive, empathic children, and I feel very strongly about that because they need to get the proper kind of support to develop their sensitivities.
You're right. We used to tell people, well, just toughen up as though this is something bad, when really you just need to learn some coping strategies. I think it's wonderful. I'm an empath. I think it's a wonderful way to be, but I need to protect because I have been hurt very badly. But I wouldn't want to be any other way.
Right. Yeah, exactly. And it just opens you up. I mean, you get to know the secrets of the universe because you're feeling so many things that other people can't feel. In terms of nature, empaths really commune with nature and animals and water, creativity. Alanis Morissette says, I love being a creative empath. So many creative people are empaths. So many people go into healthcare are empaths. I give a workshop for just people who in healthcare on how to use their empathic abilities with patients without taking on their patients' pain and stress. This is a skill set. There's nothing wrong with you if you're listening to this show and you say, wow, I'm an empath, but I'm kind of ashamed of my abilities or I'm weak. I'm here to say that it's just not true. You are beautiful. You are strong. Empathy is the trait that allows us to feel what others are feeling, and I believe it's the trait that will save the world ultimately. I feel that strongly about it. That's why I wrote the Empath Survival Guide. But in order to manage it, you have to learn how to set boundaries. You have to learn how to say no. You have to learn how to create alone time and talk to your family members so that they're not always intruding on your space.
Judith, what happens to the body when we take on too much stress?
Oh, boy. Personally, I know what that feels like. That really hurts. It's extremely painful to go on sensory overload. It just feels like lights are too bright, sounds are too loud, people are just, all over the place and overwhelming you. It's just a very painful feeling. I take care of myself and practice self-care a lot. But sometimes I experience that in airports because I travel, to give workshops. And one of my points that I'm working on to be more grounded is how to do that in airports. Because it's so overwhelming to me, particularly if flights are late and, it's jam-packed with people. So I know my stressful areas. And so at those points, I try to go sit in a corner, where other people aren't around me. Or I try to focus or read something beautiful or listen to beautiful music so I don't focus on the chaos.
I hear so many people walking around saying, oh, I'm so stressed out and I have so much to do, and they're really frazzled. And they're looking at stress as though it's something out there happening to them, where I'm starting to learn and believe that it's more an internal reaction to what's happening on the outside. Do you think that most stress originates internally or externally?
Well, we can modulate how we react to stress. I mean, certain things are stressful. If a tiger is running after you in a jungle, your stress hormones are going to be surging through your body. So there's a reality of that stress. But if you deal with it in a Zen-like way rather than freeze and panic, you have a different result. And so being an empath, and what I really suggest, as you just did, is that we need to take responsibility for how we respond to stress and not just have our buttons pushed and bam, our cortisol and adrenaline are surging through our system, decreasing our immunity, causing us to age faster, and making us feel terrible. We want to be able to say, okay, these are stressful events. Maybe map out your day before, you go through it and say, all right, these are potential peaks of stress, and this is what I'm going to do to practice self-care during those times. Planned out as much as possible, because what you can have control over is how you respond and your attitude. Our little piece of real estate inside our own bodies, that we could control.
And that's the key, because we feel like we're helpless, but we're not.
No, nobody's helpless. But it feels like you are, because there's so much that comes at you so fast.
Judith, is there a difference between an empath and someone who's just compassionate?
Yes, there is. And in the book, I talk about the spectrum of empathy. And in the middle of the spectrum is regular empathy, where your heart goes out for somebody if their child graduates, or if they're in pain. You just feel for them, natural empathy. But if you go up on the spectrum to the highest part, that's the empath. And the empath feels for other people, but they actually take the emotions into their own bodies. And so that's very high up on the empathy scale. And plus, empaths have highly developed intuition, so they can sense and know things perhaps that people in the middle of the spectrum don't know. And one thing I'll be talking about in my workshop too are the opposite of empaths, which are the narcissists, and they're at the low end of the empathy spectrum. They have empathy deficient disorder. It's strange if you're an empath and you're trying to wrap your mind around what that means, but they truly don't really care what you feel. And so for you to open your heart to a narcissist or hope you can heal them with your empathic love, it just isn't going to happen if they're a full-blown narcissist. So on the bottom of the empathy spectrum, we have the narcissists. In the middle, we have beautiful empathy. And then at the top, we have empaths.
Do empaths tend to attract narcissists in relationships because there's that codependency?
Oh, definitely. It's something I work with my patients all the time on, because empaths are constantly being attracted to narcissists, and narcissists, of course, are attracted to empaths because they're so sensitive and loving, and they love to help and they overgive, and narcissists love that. But empaths often are attracted to narcissists because they see their false self. Right. They're seduced by their false self. Narcissists can come on as empathic and loving, and, oh, you're the most important person in the world. Oh, here are some flowers. And, oh, let me take you to the ocean. I know you love the ocean. Whatever. They could really turn it on in the beginning, but, the minute you don't go along with their plan, they get cold at withholding and punishing. And in the Empath Survival Guide, I have a whole outline on how to identify a narcissist. If you're an empath and you don't know the signs of a narcissist, you are in danger, because you can be seduced by people and they put on such a good front, you can't see through it. It's very hard unless you memorize the signs of a narcissist, and then it's very easy to spot them.
Judith, can you just give us a couple of signs?
First of all, I strongly suggest everybody who suspects they're with a narcissist just provoke a conflict. Just don't do something their way and see how they respond. Because narcissists don't like that. They get mean, cold, punishing. They might not return your calls. They might give you the silent treatment, whatever. They're going to do something that's going to show their colors. So, even if you're in the honeymoon phase of this quote, I found my soulmate relationship, and you suspect they're a narcissist, just prod them a little bit. Because narcissists, they're buildings named after narcissists. In Los Angeles, we have medical centers named after narcissists. And it's wonderful that they give their money and their name, but they can, they can be the most withholding, controlling, destructive people I know with sensitive people, because they don't have a heart. They like being recognized, and they'll be just wonderful to you if you do everything according to their plan and compliment them. But if you deviate, forget it. You're off their list.
Judith, what happens in the brain when we take on the energy of another person? What does the neuroscience say about the empath experience?
Well, that's really fascinating because it's thought that empaths have a hyperactive mirror neuron system. And the mirror neuron system, these are the neurons in the brain that are responsible for compassion. And so they've done brain scans where you're hooked up to a brain scan and you're an empath, and then you see your partner getting pricked with a needle or hurt in some way. Your mirror neurons light up like crazy because you start feeling what's going on in the people you love.
That's fascinating.
And so, isn't it? Yeah, It's really, the mirror neuron systems are neurological saviors. They really are. It's the mind-spirit connection, mind-body-spirit connection of compassion and love.
Do you think that people that are empathic are perhaps misdiagnosed with things like depression or anxiety or other diseases when it's something like this that maybe doesn't require the medication that they're given?
Oh, as a psychiatrist, this is the bane of my existence. People get misdiagnosed all the time, empaths. They'll go to conventional doctors. They'll be given a diagnosis of fibromyalgia, autoimmune, panic disorder, depression, chronic fatigue, and they'll be given all sorts of medications which sort of work but don't really work. But if you're an empath, that's your primary diagnosis, and you need to be given strategies on how not to absorb the stress and angst of the world so that you develop all these symptoms. Because when empaths have a whole toolkit of strategies that they use, they are different people. They are strong, they're vibrant, they're creative. When they meet stress, they know how to handle it. They know how to practice self-care. They're not afraid to say, no, I'm too tired, I can't go. They don't become a doormat just because they're people pleasers. There's a whole range of protection techniques that you need to learn in order to take care of yourself. But once you do, wow, it's a beautiful thing to be an empath.
So Judith, let's talk about a few of these strategies that we can implement to protect ourselves. What are some things that we can do that can help us in an intimate relationship?
Well, there's a chapter on empaths and love, which I think is really important because a lot of empaths either stay single, get attracted to unavailable people, or just stay in relationships and don't speak up and are miserable. So, none of those scenarios work out very well. So as an empath in a personal relationship, you have to begin to express your needs, simple needs like, I need to spend an hour, resting or meditating, versus doing the dishes, doing the laundry, listening to your husband, watching the news, all the things that create external stimulation. You want to learn how to limit your stimulation and connect to your heart, the silence, what your inner voice is saying. And the way you do that is to learn how to set clear boundaries with your time. As empaths typically get run over by other people and all their demands, and that they want to please. But when you as an empath can say, I need my alone time, I need to sleep in my own bed tonight, I feel like, doing that. Or, I need to go take a bath and spend time taking a bath, or I'm going to go take a walk in nature. Or, say no to becoming overly committed to things. Empaths often overcommit themselves to things and, overschedule themselves, and that's the kiss of death for an empath, and that's exhaustion. And you could be running to the doctor, oh, I'm so tired, then you get a diagnosis of chronic fatigue, and it's none of that. It's you're an empath who hasn't learned to set boundaries. So, in very practical ways, and of course meditation is one of my primary practices to center myself and to bring myself back to my heart if I'm scattered, if I'm stressed, if I'm upset. I have a sacred space at home where I sit and I learn to, year after year after year, bring myself back to me, which is a centering practice that empaths need to learn.
It comes down to self-care.
It really does, yeah.
So Judith, if someone is surrounded by an energy vampire or a toxic person, practicing self-care, that's a wonderful way to manage, but sometimes it just simply gets to be too much, and sometimes you don't have the option to get away. Is there anything else that person can do to manage being around toxicity?
Yes, just notice your emotional triggers and begin to heal them so you don't do the dance with the toxic person. The problem with toxic people is that if they press your button, saying, you're not a very good daughter, you're not spending 15 hours a day with me, and you believe that, and you continue to do that, you're going to be dead soon because you can't fulfill that in any shape or form. It's not reasonable. And so to say, let's say you're living with an elderly mother and who's, not in a very good mood a lot of the time. And that people come to me all the time in that situation. And yet, you want to take care of your mother. You want to get help if you can. And you don't want to be the only one taking care of your mother. But, you have to learn to delegate, to get help. When she pushes your buttons and says you're not a very good daughter, just smile at her and walk away. And if you feel like you're not a good daughter, you need to, go into some kind of therapy or coaching to turn your head around and to realize what an incredible daughter you are. So, it comes down to emotional triggers. We get drained when somebody pushes our buttons and we react. And so part of healing as an empath is learning to identify your emotional triggers and not always just respond with intensity every time somebody pushes your buttons.
Judith, social media has created a place for negativity. Short of abstaining, how can one manage this technology while avoiding anxiety?
That's a great question because people get addicted to social media. Right. I have a group on Facebook. It's called Dr. Orloff's Empath Support Community, and it has about 13,000 empaths there. But I have strict rules in the group. I have no negative talk, always being respectful, just very solution-oriented. So I've had to set a very strict structure for this group, and so it doesn't degenerate, into arguing. There's no politics in the group because that's a sure way to get people drained and angry and upset, to have all those buttons pushed. And so, I would just stick with places on social media that are supportive and affirming. And if you're addicted to the news cycle, I would look at that and, only limit your exposure to news. Don't keep checking it. The checking, with the phones, the addiction to cell phones, and the checking aspect of the addiction to devices is what can drain people. They can't stop checking.
The book is The Empath Survival Guide, Life Strategies for Sensitive People. If you would like to get more information about Dr. Orloff and her work, you can visit drjudithorloff.com. That's drjudithorloff.com. Judith, in our final moments, we've mentioned the Open Center in this interview, and you're going to be there this month on October 15th. Tell us about that event.
Yes, I love the Open Center. I love coming to New York. I'm going to be giving an evening on protection strategies for empaths and sensitive people. So the whole evening is devoted not just to theory, but strategies on how you can protect your energy from narcissists, from energy vampires, how to set limits and boundaries, all of that. The whole evening on October 15th. I think it starts at 7 o'clock. And the book will be given away with the workshop. And you're all invited. It's October 15th, Protection Strategies for Empaths and Sensitive People at the New York Open Center. And I think you can find out either on my website, drjudithorloff.com, or opencenter.org.
Judith, thank you so much for spending time with us today. Listening to everything that you talked about, for me, I have wrapped it up with the takeaways to be mindful of the situation, practice self-care, and set boundaries. And I think those are good general rules to follow whether you're an empath or not. I mean, they're just great rules to live an empowered life. So thank you for being here, and thank you for sharing.
It's my pleasure.
This is Conversations with Joan. Stay with us. We'll be right back.